Hi guys, welcome back to our channel here at Aesthetics and Wellness. Hope everyone's doing well. For today's video, we will be discussing genetic testing, why it will be important for you to consider this. If you want to learn more, keep on watching. So guys, genes encoded by our DNA help to make us who we are. It's important to have genetic testing because it is personalized to each individual's particular metabolism, each individual's personal genetic code. So every one of us is different, and genes encode for how we look. For example, I'm dark with dark curly hair, and somebody else might be blonde with blue eyes, and all of these characteristics are encoded by our genes found in our DNA inside each of our cells. These genes we get passed on from generation to generation by our parents, and that's really a spectacular fact in biology I was always intrigued with. So here we focus on the inside, which is the wellness portion of our treatments here at Aesthetics and Wellness. And I found that understanding the underlying issue that causes a problem is more important, or one of the most important ways that you can actually impact and solve it. So we have many wellness programs here, which include your overall health and wellness, healthy mind, healthy gut, healthy hormones, healthy immunity, healthy hair. And what I envisioned was digging down to the root cause of these issues. For example, I'm thinking of one of our patients who came in who has had chronic GI complaints for years. If it's not diarrhea, it's constipation, it's indigestion, it's just feeling miserable, because the gut is at the core of you, and it has a huge part of your immune system in your gut as well. And we may have heard about this term leaky gut syndrome, and we may have heard of probiotics, and all these things factor on having a healthy gut. So I wanted to develop a program that would find out the root cause of what was troubling her inside. So one of the things we did was do a stool microbiome testing to find out what lives in her gut, essentially. And the second part of it I thought would be helpful is to do a genetic test to find out how all the genes and factors that affect her gut. And I did a gene panel for the gastrointestinal area. This will be useful in patients who have things like irritable bowel syndrome, chronic constipation, chronic diarrhea, intermittent intestinal pain, mast cell disorder, which usually affects histamine, causes swelling in the gut, chronic reflux, recurrent intestinal infections, numerous food allergies, recurrent issues like that. So if we do genetic testing which targets those, then we can see why you have these issues, because it could mean that you need to have a change in diet. It could mean that you may need certain supplements. It could mean that you're not absorbing things the way that you should. We have genetic testing, that's an example, but many other things, including for the Healthy Mind program, we do it in different ways. If you want to look at developmental, if you're younger or you find that you're stalled and you're not processing well, usually that's discovered as a younger patient, where it's a developmental issue. That would be patients on a spectrum, with patients with autism, patients on a spectrum, patients with ADHD, cerebral palsy, speech delays, someone who had a vaccine reaction that affected their brain and nervous system. If you've had dyslexia, dysgraphia, or dyscalculia, if you had auditory processing disorders or childhood epilepsy, you can look to see if there's a genetic reason why you have these issues. Now that you know that, then you can go and get a personalized treatment regarding your lifestyle, your diet, what medications you can process. In terms of genetic testing for the autoimmune system, it's one of the programs we have here as well. I would do persons who have recurrent asthma issues, recurrent infections, autoimmune diseases like lupus, for example, or rheumatoid arthritis, Sjogren's disease. If you've had inflammatory bowel disease, you have chronic dry eyes, Hashimoto's, chronic fatigue, you might want to do an autoimmune panel, which will see the genes that affect you in those areas. So we can work on fixing those. We have many treatments for that, whether it is nutrition, whether it is supplementation, IV, oral, things like glutathione, things like NAD, things to detox your liver, for example. Another panel we have for hormones, healthy hormones, would be persons, either men or women, who have issues like this. For example, in women, you have irregular menses, you have polycystic ovarian syndrome, you have just abnormal weight gain when you're like, I'm not eating that much, why am I putting on all this weight, you know? If you've had fibrocystic breast disease, you have excess facial hair or body hair, that can maybe tell you there might be an imbalance of your hormones. If there is cancer histories, like in terms of endometrial or breast cancers, ovarian cancers, a history of infertility, a history of miscarriage. If you have these things affecting your fertility and your hormones, you would probably want to get a genetic test. The thing about genetic testing is you really just need it once in your lifetime. Your genes don't change, but what you can impact are your environment, because two things impact who you are. It is your genetics as well as your environment, and that is what will really shape the end result. In men, I would like them to also do testing if they've had the same issues with infertility, if a history of cancers, fatigue, low sex drive, if you have a loss of your strength, you have male pattern baldness, or you have seen breast enlargement as a man. These are things that might make you want to go and consider genetic testing. One of the things that's you want to consider for mental testing as well in the healthy mind is your neurotransmitters, because there are many patients on antidepressants, especially now with this pandemic. People have had it's been a pandemic of mental health as well. So with that, you may want to test your neurotransmitter panel. If you've had issues with depression, anxiety, weight issues, memory issues, recurrent migraines, if you have insomnia, bipolar, you might want to go ahead and see what are the factors affecting that, because it's one thing to just go on medications like SSRIs, which are serotonin reuptake inhibitors, release inhibitors, but you might want to see, is it really the problem there? So I'd recommend considering that. There's things that you might, there's a special test, the pharmacogenomic panel, PGX for short. So this panel will be for just to see how you overall metabolize drugs. Many classes of drugs go through different enzymes in your body, especially like in your liver. So you may want to know how you process those. I'm thinking of a patient of mine who I found that, he metabolizes testosterone so quickly. Like I give him pellets, and usually hormone pellets would last, at least a good 3-4 months, but by a month or two, he would say symptoms are back, and you check his hormones are low, and I'm like, something's not quite right. Checked his PGX panel, we found he was an ultra rapid metabolizer. So therefore, he would go through these pellets and go through testosterone so quickly. And he's one of the few patients I've put on daily subcutaneous testosterone. So that helps us to make a good treatment plan when we know what the underlying issue is. Patients who have chronic pain, there's also a panel for that, because these patients also process pain medicines differently. Because, like I'm thinking for me, one time I had my gallbladder out, and while I was having the pain, they gave me this morphine. I've never taken any pain medicines in my life, maybe some Tylenol. And they gave me morphine. They gave me a ton of morphine. It did not touch me. I was like, give me something for pain, people. So I had to get hydromorphone, which is dilaudid, and that one worked. So I'm thinking of patients who say this doesn't work or that doesn't work, and I can certainly say yes, everyone is different in how they metabolize drugs. So if you have chronic pain with headaches, migraines, arthritis, inflammatory bowel disease, fibromyalgia, this unexplained pain, the back pain and spasms, there might be a genetic reason for that. So you may want to consider genetic testing there. And overall, for your overall health and wellness, a good foundation test is methylation to find out, methyl groups are attached to many of our, you can say, like molecules that we process. And when that happens, if you don't process it appropriately, you don't absorb stuff into your cells. So your cells essentially are starved for nutrition. So it's important to know if you have methylation issues. And that will tell you if you have, especially think about it, if you have like just unusual fatigue, even though you're sleeping, you're just like, I don't feel refreshed. You have those mood issues where it's just labile, where you can't sleep, you just feel anxious. Or if you notice that your immune system is just challenged, like you may find, wow, this wound is not healing as quickly as I want. Or you find that it's hard, like how you process even things like alcohol. Like, you might have a couple of drinks and you're like, wow, something's wrong here, like you feel like you're in a fall already. There are different genes that affect that, like your FOLR, your MTFR, your MTRR. All of these are just different ways. Now, genes can be turned on and off. They can be recessive, they can be dominant. And, a dominant gene will show up once it's present, and a recessive gene, you need two of them present for it to show up. But overall, I think we all have to think of our health in a personalized way, where we think, why am I this way? What makes me me? How do I react to drugs? How do I react to food? So for me, I'm on a wellness journey myself, like many of us. And as I learn, I incorporate these things into our practice here. But I would like you to, call us. We'd be happy to do a wellness consultation for genetic testing. If you've noticed any of those issues that I've mentioned, it's something that you may want to consider. So thank you so much for watching today. I hope you all have a wonderful rest of the week. Look below for our social media. If this helps you, please share, please comment, please like. We'd like to interact with you guys and get to know you. We're here locally in the community here in Sebastian, right next to the hospital. And you guys have a wonderful day.